Hi, my name is Clifford Hudis, and I am the CEO of the American Society of Clinical Oncology, as well as the host of the ASCO in Action podcast. About twice a month, I interview thought leaders in healthcare and experts in oncology, and we provide analysis and commentary on a wide range of cancer policy and practice issues. You can find the ASCO in Action podcast on Apple Podcasts or wherever you are listening to this show. And you can find all 9 of ASCO's podcasts, which cover a wide range of educational and scientific content and offer enriching insight into the world of cancer care at podcast.asco.org.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.
Hello and welcome to the ASCO Guidelines podcast series, brought to you by the ASCO Podcast Network, a collection of 9 programs covering a range of educational and scientific content and offering enriching insight into the world of cancer care. You can find all the shows, including this one, at podcast.asco.org. My name is Brittany Harvey, and today I'm interviewing Dr. Gabriela Kiorian from the University of Washington Fred Hutchinson Cancer Research Center, Dr. Mary Chamberlain from Dartmouth Hitchcock Medical Center, and Dr. Pritesh Lohar from the HCG Cancer Center, authors on treatment of patients with late-stage colorectal cancer, ASCO Resource-Stratified Guidelines. Thank you for being here today, Dr. Kiorian, Chamberlain, and Lohar.
You're very welcome.
Thank you, Brittany.
Thank you.
First, Dr. Kiorian, can you give us a general overview of what this guideline covers?
Yes. First of all, we developed these guidelines as an expert international panel because colorectal cancer poses a very large health toll in less developed regions of the world. 45% of colon cancer cases occur in less developed regions, and more than 50% of deaths from colorectal cancer do occur in areas that have fewer or lower level resources comparing, let's say, with the United States. And while there are multiple guidelines to guide diagnosis and treatment through NCCN for patients that live in the United States, we all felt that we have a need to address this very large health problem that occurs throughout the world in areas that have fewer resources comparing with the USA. And therefore, this guideline really has been designed to guide both diagnosis and staging of patients with advanced colorectal cancer, as well as their treatment through different lines of therapies and surveillance and follow-ups for patients with colon cancer. And really, the goal is to help both clinicians as well as medical societies, oncology, surgical oncology, and radiation oncology organizations and public health leaders see what types of resources and treatments and surveillance should be implemented to foster the health of patients with advanced colon cancer.
Thank you. Dr. Chamberlain, as this is a resource-stratified guideline, can you tell our listeners about the 4-tier resource stratification used for development of this guideline?
Yes, of course, and thank you for this opportunity. ASCO has developed this framework of 4-tier resource stratification based on the Breast Health Global Initiative that started in 2006, with modifications based on the Disease Control Priorities Volume 3 from the World Bank in 2015. The 4 tiers consist of basic, limited, enhanced, and maximal resource settings, with the caveat that there can be multiple tiers within one country, and even a particular location can fluctuate between 2 or more tiers depending on access to resources, such as chemotherapy and clinical or surgical expertise. Cancer management globally is highly fluid and dynamic, such that resources can change quickly, and as an international panel, we feel it's really important to have a regularly updated resource for providers to turn to around the world.
What are the key recommendations of this guideline?
So some of these key recommendations, there are actually 7 of them that we felt very strongly about defining. The first one being optimal methods for initial symptom management, for diagnosis and staging. And for example, in basic and limited settings, we recommend strongly that basic symptom control is very, very important, addressing pain, addressing bleeding, addressing symptoms such as bowel obstruction, having access to a surgical evaluation, access to transfusions, blood transfusions, as well as palliative care. And depending on the settings, diagnoses include biopsies, endoscopic approaches, sometimes imaging, depending on the resource setting. So this would be one of the first key recommendations. Between first, second, and subsequent lines of therapies, these guidelines really addresses what types of treatment options exist depending on basic, limited, enhanced, and maximal settings. And as we can anticipate, basic settings oftentimes may not have access to chemotherapy, but again, really depends from region to region and country to country. There are certain basic chemotherapy regimens that we thought are available in a broad setting, and others that may not be available except for a very well developed and maximal settings. So each line of therapy options has been separated and clearly delineated what options are available. We also addressed the situation of patients with advanced colorectal cancer that had spread to other organs, such as in the liver. And we do know that several liver-directed therapy options do exist. And we did delineate these options that are mostly applicable for the maximal settings. And of course, we summarize the optimal treatments based on resources from the surgical options, radiation options, and general systemic therapy options. We wanted to really emphasize the basic and limited settings, and really also emphasize the referral to clinics that have more maximal or advanced, enhanced resources in situations where we think a cancer could have a potential for curative intent treatment, such as removing, resecting all the areas of disease. So we emphasize that in the areas where certain options don't exist, patients should be referred to clinics with higher resources available. And lastly, is really the optimal on-treatment surveillance. How often and how should we be monitoring our patients undergoing active therapy, but also after they complete all treatments, how should we be following them up to observe any relapse and also to monitor them for best survivorship. So all of these aspects of care, from diagnosis to treatment to surveillance, are being delineated in these guidelines.
And Dr. Lohar, why is this guideline important and how will it change practice?
So thank you for this opportunity. So the whole purpose of the guideline is to help providers in clinical decision making. So the importance of the guideline is that it is applicable to several levels of resources with the strength of recommendation provided as strong, moderate, or weak. So other guidelines in practice that are existing take into account the best treatment available without due consideration whether the patient has access to treatments or whether it impacts on the outcome or the healthcare delivery burden, especially when the resources are constrained. So I believe while it will not change the conventional practice, nor with the standard of care, the recommendations presented in the guidelines identify the available resources at the local and referral facilities and then try to provide the highest level of care possible with those resources.
And how will these guideline recommendations affect patients?
So in general, the cost of treatment is always a consideration for the patient, especially in countries with limited resources to health care and specifically cancer care. So for the patients, these recommendations will help to optimize the patient-clinician communication and shared decision-making. So, for example, the treating physicians can discuss the use of less expensive alternative treatment with patients when practical feasible, and there are 2 or more treatment options that are comparable in terms of benefits and harms. So then they can be offered that option where it's less expensive but equally effective. And because out-of-pocket costs will vary depending on resource setting, patients will need to be counseled and made aware of this appropriately. So I think it will actually optimize and streamline the patient care, especially in low-resource countries.
That's great to hear. And finally, how do you envision these guidelines can be applied in low and middle income countries?
So I think these guidelines are ideally suited to the low and middle income countries, since a lot of care will be focused on basic and limited settings, and there will be less availability of the enhanced and maximum settings. So in such low and middle income countries in basic settings, sometimes the diagnosing or treating physician is not necessarily an oncologist, but sometimes one who has had an informal training in oncology and is looking for practice recommendations for the best possible care to his patient in that setting. So these recommendations include guidelines for diagnosis, including endoscopy, pathologic evaluation, chemotherapy, surgery, surveillance, and palliative care all included. So the recommendations are designed to help the clinician make the best possible decision, taking into consideration the best possible standard treatment and weighing that against the benefit of the patient. So it's a good tool for the treating physician in low and middle income countries to use as a guideline.
And I would add also that for these guidelines, it is our hope that they would be useful for many different types of people involved in patient care, such as hospital administrators who are making decisions on which drugs to buy, social workers, psychologists. We're trying to cover a comprehensive management plan such that it's useful for all people involved in cancer care.
And thank you so much, Mary. I also wanted to add that when we put together these guidelines, we took into account over 10 international guidelines, including ESMO, Japanese Society for Cancer guidelines, Spanish, Australian, Singapore. We took into account really a plethora of guidelines that we could find applicable around the world. And ASCO is so engaged in international, education dissemination that we really hope that these guidelines may be adopted by international oncology societies and both medical, surgical, and radiation oncology, such that to spearhead these approach, which we want it to be as multidisciplinary as possible, but when it's not available in certain areas, to really raise awareness that options and sometimes curative options may exist such that patients can be offered the opportunities for referrals across clinics and cancer centers. So I think we really wanted to raise awareness of the opportunities and the options that could be adopted at a broad level.
Well, thank you all for your time today and for your work on these important and comprehensive guidelines, Dr. Keorian, Chamberlain, and Lohar.
Thank you so much, Brittany, and it was wonderful working all together.
Yes, and thank you, ASCO, for this opportunity and for their excellent international organizational work.
Yeah, thank you, everybody, for helping us contribute to this educational opportunity. Thank you.
And thank you to all of our listeners for tuning into the ASCO Guidelines podcast series. To read the full guideline, go to www.asco.org/resource-stratified-cancer-guidelines. You can also find many of our guidelines and interactive resources in the free ASCO Guidelines app, available in iTunes or the Google Play Store. If you've enjoyed what you've heard today, please rate and review the podcast and be sure to subscribe so you never miss an episode.